Okay, great. Excellent. All right, well, welcome everyone. On behalf of Dr. Kirsten Conan and her team, I'm pleased to welcome you today to our forum presentation focused on self-compassion in the time of COVID-19. My name is Dr. Archana Basu. I'm a research associate at the Harvard Chan School of Public Health and a clinical psychologist at Mass General Hospital, Harvard Medical School. Today, our speaker is Dr. Christopher Germer, who is a clinical psychologist and lecturer in psychiatry at Harvard Medical School. Along with Dr. Kristen Neff, he has co-developed the Mindful Self-Compassion Program, and which has now been taught worldwide to more than 100,000 people. They have co-authored 2 books together on mindfulness-based self-compassion, the Mindful Self-Compassion Workbook and Teaching the Mindful Self-Compassion Program, among numerous other publications. Both of their websites and other resources that Dr. Germer mentions will be posted at the end of the talk in the chat box, but also on our website. This forum is being recorded, and along with previous presentations as part of our broader series on mental health and the COVID-19 pandemic, this will be available on the Harvard Chan website. Again, we will post the web link in the chat box. A couple of quick logistical points. Please feel free to use the Q&A feature to ask any questions or make any comments. Following Dr. Germer's presentation, I will be handing it over to Dr. Christy Denckla, who is a research associate at Harvard Chan, and her research focuses on resilience and has actually previously done some research on the topic of self-compassion herself. We'll have about 10 to 15 minutes for comments and discussions together. One quick thing before I hand it over to Dr. Germer. Chris will be practicing 2 live self-compassion based exercises with us today. We will invite a couple of people to share their experiences of doing the exercises that he instructs us on. If you're comfortable sharing with the forum, please use the raise your hand function, the button that's in front of you in the screen, and we will unmute you, so that'll allow you to kind of talk and engage in a conversation with the forum and Dr. Germer. With that, I'm going to hand it over to Chris.
Thank you, Archana. Thanks to you and your team at the School of Public Health for having me. Yeah, so as Archana said, I'd like to talk about what is self-compassion, review some of the research, do a couple of practices, hear from you how those practices went, and then also have some discussion with Christy. And I would like to give a second shout out to my colleague, Kristen Neff at the University of Texas, for her pioneering work. She basically started the science of self-compassion back in 2003. And we've spent the last 10 years developing the Mindful Self-Compassion training program together. She's part of this conversation, you could say. Yeah, and to begin, perhaps I should just say a few things about COVID-19, although I think hardly anybody needs any reminding, but just by way of context. At least 1/3 to 1/2 of the world right now is sheltering in place, or at least trying to. Those who can have moved their work and social lives online, and people are trying to figure out all over the world how to manage their activities of daily living, food, sleeping, movement, living cheek to jowl with the whole family. Teaching kids, helping kids learn as well as do their homework, and also staying connected to the outside world. And this self-isolation can be tough. At the end of March, the Kaiser Family Foundation showed that 45% of those surveyed reported mental health effects of the crisis, and 19%, this was 6 weeks ago, reported major impact on their lives, mental health impact from isolation. And many people are also struggling to feed their families. Many people have lost their jobs, or they're worried if their jobs are going to be there when this is over. The pandemic has also exposed pretty troubling healthcare disparities. So, for example, in a Washington Post analysis, they found that places such as Chicago and Louisiana, in those areas, African Americans accounted for 67 and 70% of COVID-related deaths, respectively. And in those areas, African Americans only comprise about 32% of the population. So African Americans and other groups are suffering really disproportionately. And so we're finally seeing these inequities that have been in our culture for a long time. Probably for everyone, there's a vein of anxiety running through their lives about whether they're going to catch the virus or not. Already over 1 million people in the US have gotten the virus, 3.6 million in the world, and 70,000 people have died in the US. So this is a crisis. And healthcare workers in particular, they're straining at the limit of their capacity. So that's the grim news. And it's also why self-compassion is so important right now. Self-compassion is a healthy response to suffering, any kind of suffering, physical suffering, emotional suffering. So the question is, what is self-compassion? Could I have the next slide, Archana? What is self-compassion? So one way of answering the question is to do a little thought experiment, and that is, how would I treat a friend in a similar situation? So what I'd like you to do is to just think for a moment, think of a time or various times when you've had a close friend who was suffering in some way. So perhaps your friend had a misfortune, failed, was feeling inadequate. So how do you typically respond to your friends in such situations, right? They call you up, oh, this happened. Or you have a cup of coffee together. How do you respond? Just think about that for a moment, make a few mental notes. In other words, what is the tone of your voice? What words might you say? What's your posture? Are there any nonverbal gestures? Maybe you'll hug a person, you know. And now think for a moment that you had a misfortune, you failed. You're feeling inadequate. You know? After some misfortune, you're about to you're lying down in bed at night. What's going through your mind? What's your attitude toward yourself? What's the tone of your voice? What kind of words do you say to yourself when you've failed or suffered a lot or you feel inadequate? What do you feel? What do you think? What do you say? And then, third question is, are there any patterns of difference? Is there a difference? So most people will say, oh yeah, you know, toward myself, I'm often more, you know, critical when things go wrong. I'm impatient. Physically, I'm kind of tense, you know. But when something goes wrong in somebody else's life and I'm with them, you know, my heart just kind of opens. I feel warm. I'm usually, you know, thoughtful. I can understanding. I want to understand. It's really quite different. And some of Kristen's research shows that actually 78% of us are more compassionate toward others than ourselves when things go wrong. 6% of us are more compassionate toward ourselves than others, and about 16% are about even. So it doesn't come naturally, but next slide, please. So in answer to the question, what is self-compassion? An informal definition of self-compassion is treating ourselves with the same kindness and understanding as we treat a dear friend when things go wrong. And that, for most of us, is not instinctive. Some people say, oh, it must be cultural, but I've taught this program all over the planet, and everyone has a cultural excuse for it. I think it's more physiological. You know, when things go wrong in our lives, we tend to have a threat response. Whereas when things go wrong in somebody else's life, at least if they're a certain distance from us, we have a care response. So it's really quite different. Next slide, please. So Kristen came up with this formal definition of self-compassion, and that is that it has three components: kindness versus criticism, self-kindness versus self-criticism, a sense of common humanity rather than isolation. You know, when things go wrong in our lives, we often feel shame, and we try to hide what happened, or even try to hide from ourselves, get distracted and distract ourselves in some way. And the third component is mindfulness, which is a kind of a spacious, open awareness, a receptivity, rather than kind of being stuck in rumination. So those three components are the three components of self-compassion. Kindness. So kindness, if there were a gesture for kindness, it might be something like this. If you can even try this right now. This would be kindness. This would be mindfulness. And then an embrace would be common humanity. So a moment of self-compassion feels like this, and like this. Next slide, please. One thing, however, is that mostly when people think about compassion, they think about nurturing. But there are actually two approaches or two sides to self-compassion, just like yin and yang. There's a being with aspect, and that's usually the nurturing side, where we might comfort ourselves, soothe ourselves, connect with ourselves, validate ourselves. And then there's also a yang side of self-compassion. Just like there's a yang side of compassion, you know, is it any less compassionate for somebody to run into a burning building to try to save somebody? You know, this isn't a, oh, it's more of a, you know. So compassion is also expressed in protecting, providing, and motivating ourselves to do difficult things, you know. And we can also do that for ourselves. We can not only comfort and soothe and validate ourselves on the inside, but also the yang side, to protect and provide and to validate and to motivate ourselves. So that's really important to think about. The yang side, particularly in the face of injustice, it comes out in the form of fierce compassion. And I'm happy to say that Kristen is now writing a book on this. I think it might even be called Fierce Compassion. So next slide, please. Now, when people think about self-compassion, they often get kind of a cringe response. They think, ooh, you know. Like even when you tell somebody, oh, I watched a webinar from the Chan School of Public Health. What was it on? Oh, it was on self-compassion. Self-compassion? Oh, I'm so sorry. Kind of makes sometimes people feel like pathetic, you know, as if, oh, self-compassion is about self-pity. Sometimes people think self-compassion is weak or selfish or self-indulgent or demotivating. You know, if I were more self-compassionate, I wouldn't achieve my goals. But actually, the research shows quite the opposite. These misgivings are actually myths, you know. So I'd just like to say a little bit about that research. And that is that, for example, on self-pity, you know, self-pity means sort of turned in on ourselves and only thinking, me, why me? But we find that actually people who are high in self-compassion ruminate less. They're less stuck in their heads, and they have more perspective on their problems. Remember the common humanity component of self-compassion is sort of, we feel more actually connected with others when we're struggling, and then some people worry that self-compassion is weak, but actually the research shows there are like 3,000 articles now in the academic literature on self-compassion. And in one word, the literature can be summed up in resilience, psychological or emotional resilience. There was a study done at the University of Texas at the Austin VA with vets from Iraq and Afghanistan. And they found that people who are high in self-compassion were much less likely to have post-traumatic stress disorder. And in fact, self-compassion predicted whether or not a person got PTSD more strongly than severity of combat experience, which means people could have experienced terrible things in war, but they're less likely to get post-traumatic stress disorder if they have this buffer quality self-compassion. So it actually it allows us to be strong. And we've seen this with other kinds of challenges, such as divorce or chronic illness, pain, and so forth. People with self-compassion are more resilient. Some people worry that self-compassion is selfish. And the research shows that actually the more self-compassionate we become, the more compassionate we are toward others. And the romantic partners of self-compassionate people describe them as collaborative, less aggressive, more compassionate, more cooperative, and so forth. Another concern about self-compassion is that it's self-indulgent. In other words, we're just going to kind of, lie on the couch, eat bonbons, and watch, TV all the time. But we find that people who are high in self-compassion actually take better care of themselves. They eat more healthy, they exercise more, they practice safe sex when they need to. They care for themselves. And they're even able to balance short and long-term goals in a way such that they are more likely to choose long-term benefit over short-term pleasure. And finally, demotivating. People think that people who are high in self-compassion are probably less motivated, but actually their standards are just as high as people who are low in self-compassion, but they are more motivated. People who are high in self-compassion are actually more motivated than others because, and this is really key, they're motivating themselves by encouragement, like a good coach, rather than with criticism. If we're criticizing ourselves to get ahead, it kind of sucks the energy out of us. But if you have an inner coach that says, you can do it, I believe in you, I trust you, that kind of thing, we're more likely to put in the energy to achieve our goals. Yeah, so maybe next slide, please. So as I mentioned, there are probably about 3,000 articles now. This slide, I think, only goes to 2018, but exponentially increasing number of academic articles. Next slide, please. And, in sum, self-compassion increases well-being, all kinds of measures of well-being, happiness, life satisfaction, coping, emotional resilience, emotional intelligence, wisdom. Across the board, decreases in anxiety and depression and stress, and also shame. Self-compassion is an antidote to shame. That's actually a subject that I'm now writing a book on, shame and self-compassion. Improved physical health, improved immune functioning, healthy behaviors, as I mentioned, and also, as I mentioned, satisfying relationships. So what I'd like to do now, next slide, please, is to give you a felt sense of what self-compassion is in your own body, so you can actually know it when you feel it, okay? So this is called the self-compassion break. It'll probably take about maybe 5 minutes or 8 minutes, something like that. And you can practice this anytime when difficulties come your way, but right now we're going to do it kind of in a meditative way. And we're going to call to mind the difficulty. So what I'd like you to do, please, is to close your eyes, partially or fully. And I'd like you to think about some way that the coronavirus has added stress to your life. So for example, maybe you're worried about a loved one. Maybe you're worried about your own health. Maybe you have a lot more commotion at the home. Maybe you've lost your job and you're concerned about money. Maybe you're just drowning in the news cycles, which are coming so intensely upon us. Maybe you're feeling lonely. Maybe you're anxious. Maybe you haven't been depressed for a while, but you're starting to feel that way. Maybe you're worried about money, you know. So please think about some way that the coronavirus has affected your life, but don't choose the most intense thing. You know, if you lost a loved one, please let's not use that in this example. So you might say a mild to moderate situation. So please choose one and we'll work with that. And if you have a situation, please just allow yourself to feel into it. In other words, if it's, for example, I'm just not getting enough exercise, feel what it's like in your body not to get enough exercise. Or maybe you're experiencing some grief. What does that feel like? Can you feel it in your body? So what we're doing now is part one of the 3 components of self-compassion. That's mindfulness. So we're bringing our awareness in the present moment to this experience. We're feeling it. And another mindful practice, just to, if you like, to name or label the emotion that you feel associated with the stress. Is anxiety, sadness, grief, anger, frustration. See if you can name the emotion. And even do it in a nice way, naming it for yourself in a kind way as you would for a friend. And maybe even feeling it in your body. When you think about this situation, is there some place in your body that you feel it the most? And, you know, or just some general area. And if so, just for now, see if you can make a lot of room for it, a lot of space for that experience. Just letting it be so. Why? Because you're not alone in what you're feeling. The details might be different, but you're not alone. We're all experiencing the stress of the coronavirus. And there are definitely people who feel just as you do. And in fact, most of us in exactly the same situation would feel just as you do. So taking a moment now, and this is the common humanity part of self-compassion, just taking a moment to connect with the size of the cloth. And that is that suffering is part of the human experience. stress and strain is part of the coronavirus experience. And that there are people right now in this moment who feel just like me, even though you might feel very alone and isolated. Just to take a moment to remember there are many people who feel just like me. Details different, feelings probably similar. Okay, that's part 2, common humanity. And now part 3, kindness. What I'd like you to do is to take your hand, if it makes sense, and just put your hand over the part of your body that might be feeling the stress or the tension or the anxiety about the virus. Where do you feel it the most? So if it's in your belly, put your hand on your belly. If it's your heart, putting your hand on your heart. And if it makes sense, just to gently stroke that part of your body. Almost as if you were stroking the body of a young child, you know. And even allowing yourself to enjoy the sensation of gentle stroking on your body, the touch, if it feels good to you. If not, you don't need to do this part at all. Just taking it in. And there's so many avenues to self-compassion. This is physical, but also there's verbal, you know. So I'd like you to imagine that you had a friend in exactly the same situation as you. And you want to share, spend a little time with your friend and share something with your friend, heart to heart. So as you're continuing to stroke your chest or wherever you feel the discomfort, what would you say to your friend in this situation? Maybe you'd say, you know, oh, you might validate, you know, that's really hard. You might say, I love you, or I'm here for you. Or if it's truthful, you know, you've got this, you've got what it takes. I believe in you, I've got your back. You know, what would you say, not to fix or to correct or to, you know, advise, but just as a way of being present with your friend? What would you say to a friend in exactly the same situation? And now, seeing if you can say exactly those same words to yourself. What would it be like now to just do a little U-turn? That's what self-compassion is, a little U-turn, and whisper those same words into your own ear. What's that like? Seeing if you can take them in. Maybe you can, doesn't matter. See if you can. Noticing how it feels to offer yourself these kind of words. Okay, and so now beginning to release the words, release the practice. And before you open your eyes, just to review what we did. Self-compassion is 3 components: mindfulness, which is knowing what we're feeling while we're feeling it, with a kind of openness, spaciousness, kindness. So that's what we did first. Second, common humanity, to connect actually with others in that moment, though we might be feeling quite alone. To remember we're not alone, that this experience is shared. And then the third part is self-kindness. So mindfulness, common humanity, and then opening our hearts to ourselves, either through touch or words. Okay? And knowing that you can practice any part of these or the whole thing anytime you like, whenever you feel stressed in your life. So when you're ready to slowly open your eyes. And we would have some time for maybe a couple of comments from anybody who has the courage to share here online with everybody. Something about your direct experience, what did it feel like to say, oh, this hurts, this is tough, in the beginning? Or what is it like to connect with others to remind ourselves we're not alone? Or what was it like to offer yourself some kind words? Love to hear from a couple of people. Anybody willing to just put up your hand and you'll be unmuted.
Hello?
Yes?
You can hear me.
I can hear you now. Mm-hmm.
Okay, great. It was amazing to feel the sadness and frustration very strongly in my neck and shoulders.
Mm-hmm.
I had not at all realized before.
Mm-hmm.
And then to hold them and to make contact with them in that very aware way was really delightful.
Thank you. So you already felt relief from simply by a kind of a loving awareness.
Absolutely. Thank you.
Thank you. Maybe a little perspective and distance and freedom in that. Yeah. Thanks. Anyone else?
I was just, can you hear me?
Yep. Yeah, I can't see you, but I can hear you.
Okay, I can see you.
Okay.
That's lovely. I think it really helped me because it kind of normalized how much somatizing I am doing. And to just sort of allow myself to have chest pain. And say, oh, poor darling. So it really helped, and it's really, it's relieved it, and to feel it in my chest. I've mainly been aware of it in my chest, but also to feel how much it's in my shoulders, and the whole idea of shoulders bearing burdens and things like that. So thank you.
Yeah, thanks. Well, first of all, I'm appreciating you're talking about, giving yourself permission to somatize, because the body is just working so hard for us to contain whatever we're feeling. And so we don't want to be angry at the body for it. We want to say, oh, and then I just loved your term of endearment. Oh, darling, because the foundation of self-compassion in some respects is to make friends with our body. Our body tries so hard to do the right thing, but we're always thinking it's not enough. It should be like this, not like that. Oh, darling.
Yeah. Thank you.
To befriend our bodies. Yeah. So thank you both. And we're gonna move on to the next topic, and as well as exercise. And that is caring for others, in particular, what is it like to balance self-compassion with compassion for others? We know that compassion for others increases when we are compassionate with ourselves, but it's really hard to do that. That is to say, to be compassionate with ourselves in the midst of caregiving. And so many people right now are doing a lot of caregiving. And in fact, people are developing caregiver fatigue, And most of us know what that's like, Caregiver fatigue is often associated with, kind of frustration or irritability. Sometimes we find ourselves like angry or even hating the people we're supposed to be caring for, dropping a few F-bombs that we never want to drop around those whom we love and are caring for. Caregiver fatigue is also associated with kind of spacing out or absent-mindedness, disinterest, avoidance, also loneliness, and sometimes shame for not being able to love or loving those we're supposed to be caring for, and also poor sleep, things like this. Is caregiver fatigue, and a lot of people are feeling this now with COVID-19. And when we talk to experts about this, what do they tell us to do? Usually they tell us, well, you need a break. You need to kind of get away. You need private time, Before the virus, people would say, oh, you should take a vacation. You should go out with friends, Still, we can say, oh, you need more exercise, So these are all what we call self-care. And self-care is really necessary when we're caring for others. We must care for ourselves in order to care for others. You know, ironically, we recharge our cell phones every day, but we don't necessarily recharge ourselves every day, you know? So what does this have to do with self-compassion? So when we practice self-care in response to suffering as a conscious, volitional effort to care for ourselves when we're suffering, that's self-compassion. And self-compassion can be mental training, but there's also behavioral self-compassion, taking good care of ourselves. So the quintessential self-compassion question is, what do I need? What do I need to feel safe? What do I need to comfort myself, soothe myself, validate myself? What do I need to protect myself? What do I need to provide for myself? So if you just ask yourself that question, even if you don't know the answer, you are already practicing behavioral self-compassion. You can also ask yourself, in terms of self-compassion, a simple question is, how would I treat a friend in the same situation, as we addressed right in the beginning? Another question is, how do I care for myself already? You know, maybe I'm a gardener. You know what? If you're struggling and you're starting to get overwhelmed, garden. That's behavioral self-compassion. But all these strategies take us out of the caregiving situation. Eventually, we got to get back into the caregiving situation. That's when it gets tricky. In other words, self-care is usually off the job. So then the question is, how can we give ourselves care in the midst of the caregiving situation? So what I'd like to do now is to offer you another exercise. Before that, if you could skip 2 slides ahead to the next slide, please. Yeah. The research is really quite clear that self-compassion is good for caregivers. Less compassion fatigue, more compassion satisfaction, greater resilience, less sleep disturbance, right? So it's a good thing to do if you're a caregiver. So we'll do this exercise together. And this is, you know, usually self-care, it just kind of keeps our head above water. And what we like to say is this is a practice that allows us to breathe underwater. So it's called giving and receiving compassion. Next slide, please. And you can do this, as I said, in the caregiving situation. Right now, we're just going to do it kind of in a meditative way. And also, this practice and the other practice and lots of other practices are available on my website, Chris and Neff's website, the Center for MSC website, which you'll get when this is over. So if we're going to do this kind of quickly, but if you want to really embody this and, you know, have it kind of take root inside, you can practice again after this little webinar. Okay, so again, please find a comfortable position, close your eyes. And just notice the sensations in your body right now. This is actually what it's like to be alive in this moment. Seeing if you can allow what you're feeling to just be as it is. Again, knowing that the way you feel right now is the way a lot of people feel. A lot of people on this call right now, a lot of people in the world feel just like you. So just letting it be so. And then finding your breathing in the midst of all the sensations in your body, particularly feeling your body breathing in quite on its own and feeling your body breathing out. The simple physical sensation of expansion and contraction. See if you can notice that somewhere in your body, your belly, your chest, your nose, doesn't matter. Can you feel it? If you're having difficulty feeling your breath, and just take a really nice deep in-breath and a nice deep out-breath. And then allow your breath to settle and just continue to feel that sensation. And now focus on your in-breath, one breath after another. And you may be able to notice how with every in-breath, your body is slightly energized. And you can also remember that with every in-breath, actually every cell in your body is receiving oxygen. So the in-breath is for you. The body is giving you an in-breath. This is a gift. The very first breath of your life was an in-breath. So just savoring the in-breath, one breath after another, and just allowing it to be for you. This is the way the body is caring for you. And as you breathe in, you can even breathe in a quality that you may need right now, kind of on the wings of your breath. You can breathe in with every in-breath warmth, or love, or strength, or peace, or a smile, or cheerfulness, whatever you need. Let yourself, with every in-breath, to breathe in what you need. Let the in-breath nourish your body and nourish your heart. Yeah, now shifting your attention to your out breath and beginning to feel what it's like to exhale one breath after another. And you may notice with every exhale that the body relaxes, you know. The in-breath is sympathetic nervous system, the out-breath is parasympathetic. Yeah, every out-breath slightly relaxes the body. There's a kind of, So this is also a beautiful thing. So just feeling that state of ease or relaxation, one out-breath after another. And now I'd like you to visualize somebody in your life right now who may be struggling in some way. It could be as a result of the coronavirus, it could be for some other reason, but this is somebody whom you care about who's struggling. Somebody you may even love who's struggling. Could be a parent in a distant place or someone in a nursing home. Or it could be your kid, you know, who can't get to see their friends. Visualizing someone who you care about. And with each out-breath, offering this person ease and well-being, the same kind of ease and well-being that your body feels when you exhale, offering that ease and well-being to the other person. Maybe even sending out some compassion on the wings of your exhalation. Over and over, letting your out-breath be for this other person. And it doesn't matter if the other person can receive it or not. It's just the giving. It's in the gift is in the giving. You're just sending goodness. And now I'd like you to go back to being aware of both the in-breath and the out-breath. Feeling your body breathing in and feeling your body breathing out. If you need to, you can even, take a deep in-breath or a deep out-breath to reconnect with both sides of your breathing. And then allowing your breathing to develop a natural rhythm. Maybe even allowing yourself to feel the rhythm of your breathing, to be internally, as it were, rocked by the rhythm of your breathing, the gentle back and forth. Almost like an internal caress. The body is always, your breath is always flowing in and flowing out. So just allowing yourself to feel that endless flow. Just like the ocean, breath flowing in, breath flowing out. Feeling the rhythm. Allowing yourself to be gently supported or rocked by the rhythm. And as you do this, also now remembering that the in-breath is for you. So letting the in-breath, as your breath flows in for me. And as the breath flows out for you. Okay, so joining this rhythm, but letting the in-breath be for me, out for you. So just feeling that for a little while. In for me, out for you. Keeping somewhere in your mind's eye this other person, but also feeling your own body. Letting the in-breath for me, out for you. And finally, if you wish, you can tweak the balance a little bit. If you need to, you can breathe in 5 breaths for me, 1 out for you, or 10 breaths for me, in, 1 out for you. So really being courageous about this, because we must care for ourselves in order to care for others. Maybe you just need, even though you're still in the caregiving situation, you just need to breathe in for yourself over and over. So finding whatever the right balance is with this person and giving that to yourself. This is a necessary gift for you to be able to sustain your caregiving. Taking as many breaths as you need for yourself and then breathing out for the other. Something good in for me, something good out for you. Okay, and so now slowly releasing the practice. Noticing how it feels in your body right now, and perhaps even visualizing that you can practice like this while you're caring for somebody else, patient, family member, friend. In fact, you can even do this when you're listening to the news. You can breathe in for me and out for someone on the news. The point is letting the in-breath be for yourself so that you never stop taking care of yourself. Okay, so now you can please slowly open your eyes. And I would love to hear maybe a couple of comments in the same way as last time. What about your direct experience? And then we'll open it up for more general conversation. Thank you all for doing that practice.
Hello?
Yes.
Hi. So I have to say that my reaction, which felt kind of funny, was that it made me feel sort of high.
A little high. That's a good thing in this time of the coronavirus.
I'll take that.
I'll take that, yeah.
Yeah, energizing, but also, yeah, sort of, yeah.
Thank you. When you say hi, what do you mean, actually?
I guess my head just felt like lighter, like the inside of my head felt lighter, or just sort of like, it felt less dense and just less tense, I guess.
Oh, okay. Okay.
Mostly,
Right.
yeah.
So you felt very much in your body. It wasn't like you were spacing out or anything.
Correct, yes.
Okay. Okay, great. Yeah. So some ease, some lightening. Thank you.
Yeah, exactly.
Maybe someone else?
Chris,
Yeah.
mindfulness for a while, and this is the first time I've really been able to do the in-breath and out-breath. I really found it rewarding. But I have a question. About midway through, I got this sort of striking headache.
Oh, okay.
What was that about?
Oh, so I don't know. Were you trying? I mean, often we get a headache if we try too hard, but maybe there's something else that was releasing, you know. Sometimes we get headaches when we stop struggling. Sometimes we get headaches when we do struggle. I don't know. What was your experience in terms of struggle? Were you struggling less or more?
No, I didn't think I was. It was just sort of came from the back and came forward. It's gone now. It was
Okay.
kind of a release, I suppose.
So it came and it left.
That's correct. Thank you.
So how did you, when it came on, what was your reaction? Did you
I was
think like,
surprised. I was surprised. I was trying to get into that, you know, awareness of now position, and I was surprised it was a headache there, sitting in the background, I suppose. It then came forward.
Well, it sounds like you brought a kind of friendly curiosity to it, though, to the headache.
I did. Yeah. No, that's a good way to put it.
Yeah, yeah. So that's a really good example of how we can hold any experiences that come up as we practice. Kind of friendly curiosity rather than, you know, panicking or becoming intellectual about it or something. You held it in a beautiful way. Thank you.
Thank you.
Yeah, so we don't have a ton of time, but we do have a little time. Archana, I'd love to open the floor for more general questions. What do you think?
That sounds great. Christy, so Dr. Christy Denckla is a research associate at the Harvard School of Public Health and will help us with moderating the Q&A. We already have several comments and a couple of really interesting questions. Christy?
Yeah, thank you, Dr. Germer. That was amazing. So the first question that we have comes from Taylor, and she's wondering if, she's asking a question about perfectionism and sort of how self-compassion, I wonder if you could comment on how self-compassion might help with perfectionism, especially during COVID-19.
Yeah, thank you for that question. And you know, especially among healthcare workers, you know, healthcare workers are just usually really empathic people who just really, really want to get it right for others. And they're kind of perfectionistic, you know, in a good way. And we get self-esteem from different sources, you know. Often we have really high standards and we measure ourselves up by those standards. Sometimes we have some are internal standards, some are external standards. Like how do we compare to, you know, others on the pecking order? But self-compassion gives us worth. We are worthy as human beings from a different source, and that is from kindness when we fail to meet our standards. And so perfectionism in some respects is I'm good when I'm like this, and I'm good when I'm like that, and I should be like this, and I should be like that, and I'm not so good when I'm like this and not. But self-worth can also come from a sense of warmth and kindness and tenderness when we fail, as well as deep appreciation when we succeed. So the difference between, the reason why self-compassion is an antidote to perfectionism is because it puts our value on a different foundation, and it's on the foundation of kindness and warmth. So it's really worth trying for perfectionists. And we'll find we're no less, we don't achieve less, we just struggle less because it's almost like somebody's holding us and encouraging us along the way, you know. I don't know, is that helpful? All right.
Yeah, it's very helpful. Thank you. This is another question coming in from Hiroko, who's saying, I understand, she understands the practice sort of on the mental level in the head, but not so much in the heart. So how can we convince ourselves that it's okay to feel self-compassion? Is it a matter of practice, or is there more?
Yeah, it's definitely a matter of practice, you know. I mean, the research shows over and over again that we get the benefits of self-compassion through practice. And one thing to say about practice is self-compassion practice is actually not hard. It's not even work. When we're self-compassionate, it's the giving up of work, you know. It's like giving up of perfectionism, giving up of struggle. Kristen Neff likes to say, oh, it's easy to practice 20 minutes a day because we struggle at least 20 minutes a day. So if you give yourself compassion every time you struggle, you've done it, you've practiced, you know. Yeah, but so we really do need to be patient. We encourage people to become slow learners, you know. Most people are kind of on the fast track. They always think they're not learning fast enough. They should learn more in a shorter period of time. But actually, compassion doesn't work like that. It's compassion. It has its own time, and it tends to be slow. But the most important thing I want to say is, when people start to practice self-compassion, they really kind of front load the sugar, the warmth, the kindness too much. What we need to do actually is we need to first connect with the struggle. We really need to open to the struggle, just like the person on the last call the last comment who had a headache, you know. We don't want to say, you know, oh, darn, I got a headache, I got to throw compassion at it. Well, we want to say, oh, a headache. Oh, how does this headache feel? We want to open to the struggle. And when we do that, then the compassion actually can fall in. The compassion gets into our heart when we allow our heart to break just a little bit. But it's not, you know, we say, oh, I don't want to let that happen, but it's not a problem because as soon as the heart breaks, the love will start to come in. So you won't suffer very much at all, and you're going to get a deeper kind of relief. So the key is, we don't want to turn self-compassion into sugar coating. We want to keep it real. We want to keep it soulful. We want to stay close to the bone where we're feeling the pain.
They're the two components very much existing in tandem.
Thank you. Yes, compassion is a mixture of suffering and love. And we can't have one without the other. If we're going to keep it real, you know, otherwise it's just hysteria, you know.
Right.
Yeah.
So I am aware of the time, and we have a few announcements, but before we close, we have many more questions, unfortunately, than we can get to in the minute we have left. But I just wanted to share this comment. Perhaps people have seen it on the Q&A question, but an anonymous attendee said, both of the practices brought tears to my eyes. I live alone, and I became a widow last year. So I wanted to say that to recognize how many people this has touched in this last hour, and to thank everyone for calling in and attending and giving ourselves this opportunity to practice. And for you, Dr. Germer, for leading us all through these experienced activities, because that is when we can really, you know, really learn on a very different level than just mentally.
Thank you, Christy. It's a real honor. Archana, the whole team, thank you so much, and everybody who has been listening in.
And I'll turn it over to Archana for a last announcement.
Thank you, Christy. Thank you, Dr. Germer and Dr. Denckla. This was beautiful and timely. And as Christy noted, in addition to sort of learning broadly the experienced practices hopefully get us started on really sort of thinking more deeply about it. With that, I'd just like to announce that our next week's forum, which will, as always, be on Wednesday at 11, is focused on helping those who serve, how family members and friends can support healthcare workers during COVID-19. This presentation will be by Dr. Patricia Watson from the National Center for PTSD. Thank you everyone again for joining and for sharing your thoughts and experiences.